Welcome again. I'm Kim Richeson. I'm with the Johns Hopkins Applied Physics Lab. And I'm excited about systems engineering. I hope you all are. There we go. In the last few days, we've had lots of conversations about interoperability, and I've heard the problem described in a number of ways. I went back through my notes, heard it described as a policy problem, a business process problem, a budget or cost problem, a procurement problem, a leadership problem, a governance problem, a cultural problem. And being a system engineer, I think it's a system engineering problem. And so that's the topic of this presentation, or a series of presentations. And in fact, more specifically, we think it's a system of systems engineering problem. And we have several presentations. First, we're going to give you an overview of what system engineering is and what system of systems engineering is and some of the unique features of that. And then we'll have a couple examples. Although I think throughout the last couple days, I don't think I heard anybody use the word systems engineering, but a lot of you are already doing it, probably familiar with it, whether you use those words or not. In particular, I was thinking this morning of the San Diego presentation from Kerry. They started with top-level vision, requirements, looked at the systems, all the systems they had, what had to change to make that happen. That's systems thinking, that's systems engineering, that process. We had, Martin talked about the example in Belgium where they had all of these, I think it was 20 or so systems and duplicate sources, and one way to have solved that would be to define standards for data exchange and have everybody exchanging data with everybody, but they stepped back, looked at it, I'm thinking, as a system of systems, and said, well, the real problem is we have too many sources for data. So they took a systems view and said, where is the authoritative source for each type of data, and limited then so that you have that source, don't replicate data. And that, again, I would say is an example of systems thinking, systems engineering. So systems engineering does not need to be complicated, although it can be. Depends on the problem you're addressing. So today, again, we have three panelists, two of which are here, and the other one is on his way from the parking lot. So I'll introduce the two of them right now. Charles Pickar, over on the right, on your right, is the program area manager at the Applied Physics Lab, responsible for a wide range of programs for various government sponsors that all involve systems engineering in one way or another. He's going to provide a background on systems engineering, system of systems engineering. And then Wayne Loschen is going to talk about the Essence Project, which is a disease surveillance and public health project that some of you are familiar with here. And that's a good example of a system of systems engineering project. And then finally, Izzy Sobkowski, who isn't quite here yet, who is the CIO of New York Department of Health and Human Services, and he's going to be talking about his HHS Connect project. So we'll, when he shows up, we will escort him up to the stage here. And afterwards, we're going to have about a half an hour of discussion afterwards. So while during these presentations, I'd like to think about how systems of systems engineering might be applicable to your problems, how it might help address, how it might bring all these other viewpoints that we talked about earlier, the policy, the business process, budget, et cetera, how system of systems engineering might help to bring a framework to addressing all those problems and achieving a good balance. So with that, Charles.
Good afternoon. Welcome to System of Systems Engineering 101. Just a show of hands, please. How many of you have already gotten your textbooks? Good, great, thank you. All right, you honestly didn't think you were coming to Johns Hopkins University and get away without having some kind of a class, right? All right, today we're going to talk about system of systems engineering. As Kim pointed out, we're passionate about it. We really are passionate about it. And for some of you, I understand that that's kind of weird, but that's okay. This is exciting stuff, and I hope to be able to show you that, in fact, it's everyday stuff, and you really ought to give yourself credit for the stuff that you're already doing. Let me just get this sorted out. Okay, so here's what we're going to talk about. I want to start off by talking about systems thinking because I think that sort of sets the stage for where we're going. We'll talk then systems engineering just from a basic perspective and then get into system of systems. We have some examples of some things you can look at to get a sense for what they are. And then hopefully at the end we'll have a relatively good discussion on this as we go forward. First thing I want to start with is what's a system? And that's a system. The system's got inputs, it's got outputs, it's got boundaries, and it's got a whole bunch of other stuff around it, and a whole bunch of stuff inside it. And what the stuff does on the inside depends on what the stuff on the outside is doing. And as you'll see, when we take and start talking about system of systems, I'm going to take a whole bunch of these gomers and put them in something else. It's going to be really big. And then there's going to be a whole lot of stuff going on inside the box, outside the box, and then inside the box. And that's system of systems engineering. So if you got that, you got the main message of what we're talking about today. First of all, how many systems thinkers do we have here? Sure, come on, everybody's a systems thinker. Peter Senge, the fifth discipline. This is Mr. Systems Thinker. Is it good or is it bad to be a systems thinker? From my perspective, it's neither. It's really what we do because we think in systems. And certainly the folks here, because of the things that you're dealing with on a daily basis, are thinking in systems. Some of them are good systems thoughts, and some of them are not so good systems thoughts. The whole point, though, is that the system becomes the overriding objective, and the system is what we are trying to focus ourselves on in order to move the dial, in order to make a difference in the things that we're going to do. And systems engineering is one of the tools that can make the system do what you want to do. So let me talk about systems engineering. Basically, systems engineering is a problem-solving methodology. Very, very simple methodology. I'm going to show you some pictures of this. In fact, at APL, we have two basic ways of looking at problems when we're asked by our sponsor community to look at various issues. We'll either use an operations research perspective or a systems engineering perspective. As you'll see, sometimes these lines blur, but it really is a problem resolution method. So what we're doing is we're considering complex problems. I'm going to have a word about complexity here in a moment because that's an important point to get across in the context of systems. And the fact is that we have a whole bunch of options. And systems engineering really allows you not only to consider the things, but really get at the meat of the options to come up with, hopefully, what the optimal solution is. And that's really what we're all about. So we're out to find the ones that don't work and don't fit and keep the ones that do. And that is systems engineering. It's just that simple. It's not that hard. Again, you're doing this all the time. Now, this is a very neat picture just to show you another way of looking at systems engineering. And if you look up here, where right about in the middle, just on top of the bridge where you see critical needs, that's kind of where we start. The needs in systems engineering speak, needs is where you have to start. You have to identify what it is that the problem is. That's the problem, that's the need, whatever you want. If you note just in general terminology or in general chartology here, that this spiral actually ends up where you see deployment is up on the top. What we're doing in systems engineering every time is we're identifying the needs, we're looking at what kind of capabilities we have and what kind of capabilities we need to solve the problem. We're going to go and look at various alternatives to say, this could do it, this couldn't do it. Again, systems engineering is looking at the optimal solution. We're going to then go through some sort of a methodology to make sure that we got the right answer. We're going to validate and verify that we've built the thing right and we built the right thing is really what that's all about. And then you see we're going to implement and then we're going to deploy that solution. Now, what I just did was I just went around the circle, and again, there's a gap, as you can see, between the needs and deployment. And the message here is that systems engineering never ends. It never ends because the work that you do never ends. The problems that you do have never end. The problems that all of us have are always addressed in one way, shape, or form, and then depending if you are an optimist or a pessimist, you could say that's a good thing or that's a bad thing. But the fact is, and this is what one of the things that systems engineering is about, we recognize that we really have to be leaning forward. We have to be able to anticipate what the next challenges are going to be, and then be ready to solve those challenges. We can't sit back and rest on our laurels. So there's a whole bunch of words about what systems engineering is, and I kind of just talked all about that. A couple of the takeaways here: it's a structured development process, and just a word about that very quickly. There's many people, I'm sure nobody in this room, but there are many people who just say that systems engineering is all about process and nothing else. And you know what? That's absolutely true. It is about process, but it's not process for process's sake. It's process in order to move that needle, in order to get ahead. Systems engineering, like system thinking, focuses on the whole. We're looking at the system. Go think back to my original chart about system. I want to know what the inputs are. I want to hopefully have some say on what the output is. And since I tend to, and I'm able to establish the boundaries, define the boundaries, and hopefully that surrounding area is the area that we all work in, I can understand all that, then ideally I'm going to get to where I really want to be. And I'm talking at very high levels now, and I see some of you, in fact, there's a number of question marks now forming over people's heads, and we're going to get right to that. The bottom line here is this last point. Systems engineering addresses complexity. Does anybody have a problem here with complexity? I didn't think so. Everybody's got it, right? Complexity is the bane of our existence today. But what systems engineering is all about is making the complexity transparent to you. I brought with me to show a presentation to a colleague over in the School of Arts and Sciences, some work I'm trying to do with them. I have my iPad with me. And the iPad's a really neat kind of thing. It is about as complex an instrument as you get. Everybody's familiar with iPad, right? Or an iPhone. You guys. And you just touch and things happen on the iPad, right? I mean, how cool is that? But that's a perfect example of what I'm talking about, where systems engineering can take care of complexity, because the complexity is totally hidden from you. You don't have to worry about it. You don't have to think about it. What you are out to get is your answers. And as you'll see when we talk system of systems, and in the context of the work that Kim has been doing in terms of tying all systems together and come up with a whole that is actually greater than the sum of the parts, we want to make sure that we don't let complexity get out of hand and we turn a whole bunch of people off. Really, really a key point. But let's talk about complexity just for a second. And I use this chart. I actually use this chart in a course on systems engineering I teach, because I think it's important to put things in context on this continuum. And I'm going from simple to chaos. Some would say instead of a circle, instead of a line, that's actually a circle. That simple borders chaos sometimes, and I wouldn't disagree on that. But for the purposes of what I'm talking about here, we are over on that right side of that chart. And in many cases, arguably, and I would suspect one or two of you have faced this in your daily work, it sometimes seems rather chaotic to you. Again, systems engineering is hopefully out there to solve those problems, or at least address what the issues are to allow you to solve the problems. What are complex systems? Here's a complex system. This is, Kim tells me, a human services information system. I can tell you're all impressed by it. It's very complex. Look at all the stuff that's going on there, and I haven't even put people in there yet. And when I start putting people in there, then it gets really out of hand. That's an example of a complex system. This is one of the things that the Applied Physics Laboratory is working on right now in the world of biometrics and some health. What you see in the picture is an individual who is actually moving that prosthetic arm. I mean, it real advances. That's complex. That's real complex. Complexity is what systems engineering is out to address, but complexity in the context of the things that you're dealing with and the things that we would like to help you deal with is but one element of a much larger set of things. But the fact is that complexity lives every day, especially here in the greater National Capital Region. There's some people in Baltimore that don't like that, but that's what we call this. And this is a missile defense system that actually, from a technical perspective, is incredibly sophisticated. It's able to do all kinds of protection things in the context of this larger system. All right, now take a look at that picture. I showed you pictures of complex systems. Is this a complex system, do you think? What do we have there? Third world nation, more than likely. Maybe second world, probably third world. Got some things happening there, not quite sure what's going on. Is that a complex system? Or, which is what I'm going to suggest to you here as soon as I make this thing move, is this a system of systems? Let me just let you look at this for a second. So take a look at what's going on here. I just drove a truck onto two rather large canoes. For those of you with maritime backgrounds, you note that the water is not that far from the top of the thing. You note this lady in the front, she is just bailing to save everything because the water is just coming in like you couldn't believe. And those boards that the truck's sitting on are just sitting there. They're not secured or anything. I have a propulsion system there, and the river's moving really, really kind of fast. So what's going to happen here? What's going to happen? And boy, she's bailing, she's bailing, she's bailing. And now they got the guy in the front bailing too because it's getting worse. And look at that. This is an example of system of systems overcoming the complexity of the task that these people were having. Think about this for a second. They didn't know they couldn't do it, so they did. And what I want to suggest is that this whole idea of not knowing that you can't do it and do it anyway is something that's very, very important. And I'd argue probably that over half of you have already been in those situations in your professional lives. And the main point there is that's one of the things that system of systems engineering is all about too. We're out to look at the things that we can't do because everybody told us we couldn't, and then make it happen. So let me just talk about some foundational characteristics. How do you know it's a system of systems? These are 5 things. Operational managerial independence, heterogeneity, emergent behavior, and evolutionary development. I'm going to go back to my friends here and say, all right, operational independence of the system. The operators who own the system and the actual system itself remains independent here. It is not, at this moment, he wouldn't drive it any further. Let's take that point for real. But the individual controls the fate of each of these things in here, those canoes, the boards, everything. Operationally independent. Managerial independence. The folks that own all these pieces not only can operate them, but the way that they're managing them is up to them. They're not ceding any control, with the exception of safety, right, to keep the thing from falling off in the water. With the exception of safety, they are maintaining still the control. If this is not heterogeneity in systems, I don't know what is. We have human systems there. I can classify these as, actually I made a list. Let me just read it to you because I was playing with this last night in preparation for this. So we have a transportation system. I have an independent river navigation system. I have housekeeping or shipworthiness. This is the lady who's bailing there in the front. I have propulsion system and navigation system, a loading and unloading system, a river interface system, and you couldn't hear the actual sound playing here, but there's a warning system too. And it is expressed by the human voice. Real, no kidding, heterogeneity. The systems engineering takes things that aren't alike and puts them together in a whole. Unlike my friends in the software engineering world, God bless each and every one of them, they deal with homogeneity. The things that software engineers do is code, and they put it together. Now, they would argue, this gentleman here is smiling, and he's going to slam me once he gets up here, but that's okay. But really, systems engineering addresses heterogeneity. Emergent behavior. This vessel now, this complete vessel, is doing something that everybody in this room probably figured it couldn't do, right? How many of you thought when I started this that this thing was going to end up in the water? Come on, be honest. Yeah. And it happened, right? I mean, they made it happen. That's emergent behavior. It's behavior that we couldn't necessarily predict, but because of the system itself and the way the system was put together, it actually happened. And then finally, there is a real evolution here. I would love to, this movie clip was provided by a former systems engineering student of mine, and the email he sent it in, he said, no regulations, no laws, but it is evolutionary development, and I'd love to see the tape right after this one, the next time they did that, because you can guarantee that they learned something from this. Those folks learned something from this, and they're going to make it better the next time. I don't know, put an 18-wheeler on there or something and get 2 more canoes. They're going to do something, but it's going to get better, because that's what happens when you really let the power of systems engineering loose on these kinds of things. Okay, some definitions for you, and that's about enough. All right, now, let's just talk about some of the points about, it's there for your reference. You're going to have these copies of these files, right? But I really just want to get into some of this. The purpose of systems engineering is to leverage those synergies of legacy systems, leverage what's there, and really, really, really make the whole greater than the sum of the parts. And you know what? We can do that. We can actually do that, and it's happening. And I just gave you some, and I'm going to give you some more examples of it. The system architecture is, as you can see, dynamically reconfigured. To think back to the example there, that architecture of that system of systems changed from the time they started on one side of the river and to the other, right? And that's the same thing that happens when you are applying a system of systems engineering effort onto those legacy systems that we've been talking about. Interoperability is really what we're all about. We are interested in the interfaces. We want to really understand those interfaces, because that's the key to interoperability. That's the key to getting everybody to play together and not run with the proverbial scissors. In the world of systems engineering, you have something called the ilities. And the ilities are just the last half of any word. And you can just start. I got maintainability. I got flexibility. I got agility, and so on and so forth.
You've got unpowered.
Oh, this is clearly a systems engineering book.
Power must be plugged in. Sorry.
May the force be with you. Thank you, Dan. He's got a home right here. And then finally, when you buy these things and manage these things, they are bought separately. They can be managed separately, but they can also be managed together. And that's this piece that I was talking about in terms of the operational and the independence of the systems and the managerial independence of the system. So this is just a nice little thing just to say, why do you want to do it? We believe, and this is actually, we have empirical proof of this almost across the board, that you're going to increase efficiency. You really are going to increase capability of those basic systems and put together in a whole now, and they're going to be more adaptable to any kinds of challenges that you may or may not be able to foresee. One way to think about it is on a level basis. If the lowest level is the solution level, this is where things are happening. This is the rubber that meets the road. And there's systems down at that level. Let me just build this up really quickly. If you want to, you can, in fact, take all these and put them together in a whole that will not affect anything of the owners of the systems. Again, that's one of the key tenets here. But you can, in fact, and you will have, and you'll see an example of it, two examples of it here shortly, of what happens when you actually do that. This is another, so these are examples of system of systems. This is just a picture of a whole bunch of things put together. Think of the National Airspace System as probably the most familiar system of system, that the most identifiable system of systems with which you are probably familiar. The National Airspace System includes all the people that are moving and freight that's moving. It includes all the aircraft that are moving. It includes those air traffic controllers that are awake. It includes the radar systems, and so on and so forth. That is a great example in the upper left corner there of a system of systems. To any number, this thing in the middle on the lower is an example of one of these very sophisticated baggage handling system of systems in an airport that's actually moving the things all over, but taking legacy and putting it together with new. And as you can see, we're going to shortly talk about these. I just want to end up with, I just want to talk about this as the last thing I'm going to talk about. And point out that from a human services perspective, there's any number of ways from a system of systems analysis that you can take a look at a problem. But some of the work that we've been doing and some of the work now we're getting ready to do and some of our own independent work is looking at how do you get your arms around this really, really complex system of systems that we're calling human health and services. And how would you address this from the process perspective? So we're starting over here on the translate and understand requirements and going around. And if that looks very similar to what I showed you earlier that systems engineering is doing, it is. There are some minor tweaks in it because what I have to do is we have to account for the fact that we are now talking system of systems as opposed to just the plain systems. But this, in fact, is a pretty tried and true process that when we have applied this in the past on the system of systems problems that we in the lab have been dealing with, we've been pretty effective. So with that, I think I'm going to say you can look at this, and thanks for your attention.
So I'm going to discuss an example of this systems of systems. So in 1997, we were asked at Johns Hopkins APL to look into the issue of how would one go about looking for or detecting biological weapons or attacks or outbreaks of disease. So the first question we sort of asked ourselves, or what do people do when they're sick? All right, you guys have been pretty interactive today. What do you do when you're sick? Go to bed? Go to a doctor? Sorry, what? Google your symptoms. There's a good one. Call in, don't go to work. That's right. Make other people miserable. Yeah, that's a good one.
Only if you're a man.
Oh, now. Wow, very congratulations. What about your children? Do they go to school? No, they stay home. Do what?
Go to a pharmacy.
Go to a pharmacy. There you go. Pharmacy or over-the-counter drug medications. That's exactly right. You can get into some crazier ones. Do you sit at home and watch TV instead of going to work? So maybe you're watching a lot more TV during the day. If you've got a GI illness, maybe you're going to the bathroom a lot. So we started thinking about all these different things, and it turns out there's a lot of data out there that you can collect to monitor for these things. So if you're watching pressurized water systems, you can determine if people are flushing their toilets too often in weird times of the day. If you're watching for Kleenex sales at grocery stores, you can determine whether people are sneezing too much, or thermometer sales actually turns out to be useful. Orange juice sales, Pedialyte. school absenteeism in certain states and counties that actually collect it correctly. There's some schools, I'm just telling you. So there's an awful lot of different sorts of data sources. So what we did was created a system known as Essence. It actually is an acronym because you're forced by law to do everything with acronyms. It stands for, let's see if I can remember, the Electronic Surveillance System for the Early Notification of Community-Based Epidemics. Hey, thank you. So in the upper left-hand corner there was sort of the original idea that if there's some event, it's going to have an infected population. And this doesn't have to be people. It can also be, agricultural, livestock, birds, all sorts of different things. And each one of those are going to impact data sources. And most of these data sources are already being collected for other purposes. The drugstore is collecting inventory so that they know when to restock shelves. The emergency rooms are collecting information about their patients so that they can charge them money. So these things already existed. What we then did was brought together a team that sort of merged the epidemiology side, the math and analytics side with the IT side. And we found that to be sort of unbelievably important. We have team members who are physicians, are meteorologists, systems engineers, maybe systems of systems engineers as it turns out, and brought all of those folks under one roof. And then the other big thing we tried to really do is work with local public health jurisdictions, whether it be at counties or states, to really figure out what those needs are and go from there. And from that, we then built a web-based application that pulled together a whole bunch of information and started looking for these outbreaks of disease, whether they be naturally occurring or man-made. So if we go back to some of the slides from earlier, we talk about some of those key points of what a systems of systems is. It's this use of independent systems. Public health doesn't get a lot of money. So it's not like we're going to go out and start collecting this information by physically putting people in doctors' offices or over-the-counter drug medication stores. But because this data is already being collected, you could tap into it. So pre-Y2K, we started this project to go out and pull information from emergency room chief complaints out of emergency rooms, military treatment, ICD-9 codes, family physicians from individual clinicians, HMO triage calls, over-the-counter medication sales, school absenteeism, laboratory test results. We even had animal data for a while. One of the interesting stories, we had national zoo data until some of the rare birds and animals started dying, then they shut that feed off. One of the more interesting ones was a Friday afternoon. We had over 250 birds die, and that was sort of shocking. Of course, everything bad in public health happens at 4:30 on a Friday afternoon, as you all know. And so 4:30 on a Friday afternoon, 200 birds dead show up. A poor woman had taken 200 electrocuted starlings to an animal rehabilitation center. And it just, that's data. So we pull all that together, we put it into our system, and we start collecting data. We build the math, we build the fusion algorithms, and we try to build the visualizations so that public health can discern what's going on out of this. Now, from speaking of independent systems, these data feeds act however they want to act. If a hospital changes systems tomorrow or drops a network connection for a week, these things happen. And one of the fun things we had to do right off the bat was get the math folks to realize that they were playing in a real world and not imaginary perfect worlds where the data is always clean. And so they would go back and hand me an algorithm, and the very first thing I would do is shove a bunch of zeros in because it's going to have a network delay for a while, and it would break and take it back. And they were so frustrated with me by the end of the day. But those are the sorts of things, when you're dealing with totally independent systems and you're at their mercy, you have to be able to deal with. So then we started dealing with integration of multiple systems. And so here's a sort of a layout of the National Capital Region. We mentioned it earlier. In the National Capital Region, there are Essence systems in Maryland, D.C., and Virginia. We also then created an aggregate node where they can share de-identified information to kind of get a picture across the landscape. Because, as we all know, disease doesn't stop at county boundaries. It's going to flow across. The other part of this is by integrating it this way, certain data sources that were easier to get at a high level and distribute down could flow that direction. And other data sources where they wanted fully identifiable information could flow up and then be de-identified and pulled up through the system that direction. Geographic distribution. Right now, Essence is located in quite a few different places, but like I mentioned before, both at the county and at the state levels. We also have 2 regional systems, so the National Capital Region spans across state lines, and the Missouri and St. Louis version goes across state lines. The only people that make money out of this deal are lawyers, because that was probably the biggest hurdle to all of these things, is trying to get everybody to agree legally what they could and couldn't share. From there, we moved into the Veterans Affairs, which is the national system, and the DoD system, which is global. So the concept of evolutionary development. We developed the idea early on, and originally the entire project was meant just to show off algorithms. Being math place, math heavy, everybody was excited about algorithms. I was sort of brought on just to build a few pretty pictures to show that the algorithms worked. To prove the value of the idea, we did Y2K surveillance, because some people were convinced planes were going to fall out of the sky at the stroke of midnight. And so we started collecting data before then. And we went through the prototype. It went pretty well, and DARPA decided to kind of fund a 5-year project to research the idea. 9/11 occurred, and it just so happened we had never shut off our Y2K data surveillance. And so that afternoon, we were asked to go production in the state of Maryland. And within 2 months, we were in production globally for the military as well. So life changed a little bit that day. We went from a cool research project about algorithms to an operational system the very next day. At that point, instead of proving the value of the idea, we sort of changed to, all right, we all agree this is something we should be doing. Now let's start expanding capabilities. So what other data sources can we have? We had sort of systems engineering processes for evaluating new data sources, whether they should or shouldn't be added. New user types. We had never thought of the fact, but as a dual-use system, people using every day, we started bringing in researchers who wanted to do an asthma study, or somebody who wanted to do a totally different type of study versus infectious disease we didn't even think about ahead of time. New installations, moving it out into different places, and obviously new features. Anytime you build a system, somebody always wants something else. From there, the focus changed from the system to more the domain, the public health disease surveillance domain. A little bit of this changed from information systems to detection versus detection systems. So again, stemming from this infectious disease detection, trying to find that thing before anybody else, instead sort of fell away and turned into the concept of information system and information sort of situational awareness. I want to be able to see what's going on inside of my community, whether or not there's an alarm going off or not, because I may get a question from the governor or from my peer, and I need to be able to answer it right away with the data that I now have access to. Information sharing, being able to share across other jurisdictions, and we mentioned the regional systems. So that went on for a little while, and I think now we're sort of in this re-examine and refine sort of area. So now we're getting into data quality issues. It's funny, we've gone 10, 12 years in this domain, and nobody cared much about the data quality. They just figured whatever they could get was great. Now they're to the point where they've been using this system so often, they're having to go back and say, well, are those graphs actually true, or did they just make a pretty picture? And user efficiency. We finally had a study down in Florida, Duval County. It was a tiny little study with just 3 people, but they made them do all of the work they currently do without the Essence system for a week and figure out how long it took them to do. And they gave them 8 tasks that they currently do, 3 of which they couldn't do at all anymore. And of the other 5, it took them like an average of 4.5 hours to do. They went back and gave them Essence again, and they were able to do all their tasks in 45 minutes and do the 3 that they couldn't do without it. So when you start putting these systems in place, you do get the efficiency. It's just sometimes it's hard to collect the metrics to prove it. From the emergent behavior side, I sort of follow it this way. When avian influenza came out, this focus changed a little bit from specific to bioterrorism to more dual-use infectious disease. When SARS came out, it really changed these systems. Originally, we were considered syndromic surveillance. Everybody was looking at these broad categories of respiratory or GI. When SARS came out, there was an actual case definition. And if you had emergency room chief complaints where you could specifically look for keywords that you really needed to look for, you had a huge leg up over just looking at these gigantically broad categories. So the concept of doing things in a very rigid manner off these syndromes just fell away. SARS forced everybody to be flexible and be dynamic in their system development to allow users to do whatever they needed to do at the time. H1N1, Katrina, Haiti, proved again a lot of different stuff about we needed not to just be trying to detect something, but we needed to have situational awareness of what's going on. Folks were using keyword searches to look for Katrina patients in Maryland or Indiana or anywhere else, trying to kind of keep track of where these people were coming from. I know with the Haiti earthquake, they did the same thing. They were able to track in Florida where all the folks from Haiti were falling into the hospitals by looking for keywords. H1N1, exactly the same way, constantly being barraged with questions from above saying, where are these people going? How many people are hitting our emergency rooms? How many people are getting the prescription drugs? So having access to that and being able to do situational awareness, not just detection, so that emergent behavior changed again. Now, because of the High-Tech Act, we're changing again, and it's getting more data. So we're getting into the concept of big data analysis and visualization using full electronic medical records instead of just the sort of tiny skims of data that folks have been trying to pull off before. They're starting to get access to these floods of data. So how can cloud technologies, and instead of looking at general trending of when people show up in the emergency room, start trying to dissect how severe a patient is. If I look for somebody who walks in the door with cough, and then I also look for another patient who has cough, but they turned around and got a chest x-ray and a medication and came back the following day, they're a whole lot more severe to me than someone who just had cough and was sent home. Before, we couldn't detect those sorts of things, but with the High-Tech Act and the additional information, those things are going to start becoming possible. So all along the way, you're doing things with systems of systems where if you just had one data set, you're not able to do. But by pulling together all of these things, both either whether it be multiple systems, regional sharing, or whether it's different data sources, you can start to kind of do things you couldn't do before. So that's my example of systems of systems.
Since I introduced Izzy once before and he wasn't in the room, I thought I'd do it again and I thought I'd also help him find the PowerPoint here. But Izzy Sobkowski is from New York City. He's the CIO of Health and Human Services there, and he's going to give us another example of systems of systems.
Great.
Izzy.
Thanks so much.
Thank you.
So first off, sorry I just ran in, but in this case it was 5 states in one morning just driving down, and in fact the system of systems worked. So I just drove down from Connecticut, and as my colleagues are talking about, I had my little Easy Pass up on the windshield, and remarkably that Easy Pass took me through various toll plazas and bridges and all the rest and got me here kind of seamlessly. I didn't have to think about that system of systems. As I'm sitting here, I'm thinking about another system of system a bit more complex, which is, I guess I really am, still a geek, which is there are 3 different devices that I work with. And they do use different systems. They're different technologies and Wi-Fi and 4G and 3G and all the rest. And they actually also interoperate seamlessly, which is kind of cool. So it stops being an academic exercise. There's one last one I want to pull out. We're talking about ATC, or air traffic control, so I'm a private pilot as well. And when you think about flying in the system, suddenly there are little guys like me with a single-engine airplane, basically a paper airplane you can throw, and there are 747s floating around in that system of system, and things pop up and pop out all the time, and you've got complexities of weather. And all these systems actually do, in fact, talk to each other, similar to the drive down here. I used a GPS. Sometimes I use, on my handheld, a product called Waze, W-A-Z-E, which works in both directions. Not only am I getting information for where I need to go, but I'm also transmitting information for where I am and if I've seen a traffic jam or something. So systems of systems are very complex and are used in our everyday life. But let's come back to why we're here. So our domain for today is New York City Health and Human Services. That's what we do. And I see in the room is Barbara Cohn, who I can point to. Barbara is on my staff and very much involved with our data governance. And I think of smart systems, which is kind of why I was hired onto this. And smart systems really requires a system of systems, and I'll go into some detail on that as well. So the stuff that seems to work in life doesn't come from things that, wouldn't it be really neat if we did these things? But there's a need, and it says, let's find a way to go ahead and fulfill that need. And I think almost by definition, what we're doing in New York City in Health and Human Services is a system of systems. And I hadn't really thought about that term. A colleague and I just wrote a paper on system of systems where we thought about that, but I realized I've been doing system of systems at New York City since I came on board. And on the right side of the slide, you can see we have a number of different agencies, and each of these agencies has years and years of legacy systems. So we have these systems. Now the question is, how do they interoperate, and why would you want them to interoperate? And the answer is, I don't think I need to tell this audience, silos in Health and Human Services are not a good thing. So how do you break down those silos? And we did that kind of early on, just see if that's that slide. We did that early on with a product called Worker Connect, part of HHS Connect, and I'll touch upon that in a second. But there really was a motivation for change that's breaking down these systems. The case study that hits me hard in a very positive way, we've had examples of negative things that have occurred in Health and Human Services, but a very powerful one occurred about 6 months ago. We're using our Worker Connect product. We had a situation where there were two kids. I think there was like a 10-month-old and a two and a half-year-old girl, 10-month-old boy and a 2.5-year-old girl, that were found abandoned in our Port Authority on 42nd Street. And using our product, ACS, our Child Services, working with the police department, we're able to go system by system and discover from the girl's name who the mom was, locate the mom. She said, hey, the kids are with me, so we kind of knew that she wasn't all that useful. Locate the fact that through a lease in our public housing, that there was, the mom had a sister. The sister was taking care of two other kids. We were able to very quickly, I think the whole turnaround was 3 to 4 hours, very quickly unite the 4 children together, put them in foster care until this whole mess got sorted out. So crossing across those systems is not an academic process at all, but is really gets to a good outcome, which is all that what this is about. So building upon that kind of success, and we did that in a federated system. We're looking for some quick wins, which is kind of the way that we operate. And quick wins, again, I'm kind of new to government. This is about 1.5 years for me, or less than 1.5 years. A quick win in my other life, which is an entrepreneurial life, is 30 days is a quick win, or 15 days is a quick win. These are more like 6-month to 9-month quick wins, but they're very large. So I understand that. Our desire now is to take our federated system and move it into a more data-centric system to give us a possibility for a deeper analysis and a different type of outcome in our system of systems. And I'm kind of building up to that. So one of our thoughts, again, think big. This is a large project that we're taking on, which is really huge amount of data from multiple agencies in advanced technology, and we're taking it on ourselves. We're not looking for system integrators to do this. So we're thinking big, but our implementations are small, practical, reasonably priced, reasonable delivery, and we have a kind of hanging over our head, we have a target, which is the next year and a half under this current administration, to put facts on the ground, which will allow us to move across to the next administration in the city. We really do have a mentality of how can I make it better. That's it's not a trivial thought. We are a very forward-looking part of the city, and we do take the time for formal change management. So I think a lot of folks in this room have heard about HHS Connect in the past. My boss has presented last year, I know that. But we'll talk about some of our ability of actually getting this across. And that is our governance and our transparency. So system of systems, again, if you think about it from a technical point of view, okay, well, there are lots of systems they can go ahead and interconnect. And that's not a small sentence. The ability to interconnect, when you're talking about system of systems, really is the interface. If you can get your interfaces correct, and if you can get your interfaces extensible, then the technology moves along pretty easily. But equally important, or probably more important, from system of systems, is having the authority, having the political ability, getting the various commissioners on board, getting the governance structure on board, the transparency on board, and everybody kind of moving in the right direction, or in a direction, hopefully the right direction, with clarity, commitment, transparency, and building confidence as you move along, and especially building confidence from our OMB, our Office of Management and Budget, because they control the purse strings. If they're comfortable, then we move along. So we actually meet on a monthly basis. I have my next steering committee coming up on the 26th, just right around the corner, and on the drive down, just discussing, our deck for the steering committee, with involved commissioners, with involved deputy mayor, with transparency, and moving with deliberance in a certain direction toward moving these systems together. We have evolved. I mentioned Worker Connect and gave that example of uniting these children. Worker Connect does other things which are kind of mundane. So in this case, if we talk about a federated system, meaning our agencies which have their data own their data, we, that is Worker Connect, don't own the data. We don't act in any capacity over that data, but we are able to search. We're able to investigate across agencies in a federated system and come back with results. Some of those mundane things are, for example, Health and Hospitals Corp. Somebody comes in to the emergency room, they get service. Now the question is, are they covered? Can we sign them up? So suddenly they're in Health and Hospitals, and we can also see if we can sign them up for Medicaid. That ability to move across systems helps our client, our citizen, get to a better space. Connect has also introduced our first case management system, and we're in the process of introducing 2 additional case management systems. So we introduced a case management system for homeless, and we're in the process now of building 2, one for juvenile justice and child care Head Start. So these are very different systems, and they use different technology, and they've been implemented differently, yet they talk to each other through this common bus that we've created. As we move forward, and this is where, to me, it becomes extremely interesting. As we move forward toward big data and business intelligence, and then the predictive analytics, so the data sciences and artificial intelligence, being able to start to look for outcomes and the best possible outcomes for our clients. So Worker Connect, as I talked about, is a federated system, which means, again, all of our agencies own their own data. And even if we move into big data, they will also own their own data with some modifications. Of course, they will own it, but we will probably have a copy of this big data as well. So there are engineering issues, but you can see the policy issues continue to parallel in a very significant way. There's a bunch of buzzwords on this. I just, that's the techie in me again, but we are very forward-looking with HDFS, the Hadoop file system. Hadoop in Hindi means elephant. It's just another term for big data, or map/reduce, which is something that Facebook and others, Google, are using. And again, terms like PIG, which is short for Pig Latin, because it's just yet another. I'm just putting them out there because I don't think anybody in this room will next year not know these buzzwords if you don't know them already. But our desire is to create a mechanism to collect huge volumes of information in all kinds of disparate forms, both structured and unstructured information, graphics, video, voice, etc., and be able to access that quickly and intelligently across different agencies and different systems. The business intelligence, the best way I've described that to my steering committee is, again, New York City, Mayor Bloomberg, and he made his money with the Bloomberg terminal. But if we look at an integrated dashboard for HHS or a Bloomberg terminal for HHS, the ability to look across different systems and get information on an as-need basis, on a just-in-time basis. So heat maps and pie charts and other kind of information, and ability to drill down and drill down and drill down till the right person with the right authority can have the right information at the right time to help the client at the right moment. And then we take it a step further, which is the artificial intelligence. And here are some other buzzwords like Mahout. So if Hadoop is an elephant in Hindi, Mahout is the person who sits on top of the elephant and kind of drives them. In this case, the Mahout is machine learning. And it's distributed machine learning, our ability to extract information using data science mechanisms from a huge amount of information. So the AI piece gives us two approaches. I list here Mahout and CBR, case-based reasoning, and I'll put a little pin in case-based reasoning for a second, but also highlight expert systems. So case-based reasoning and expert systems, an investigation, I'm not a social worker. This is a new world for me. But being able to talk to my subject matter experts and extract the knowledge that you have and reduce that, so I shouldn't say reduce that, but distill that, understand some of it, scratch the surface of your understanding. Top down, talk to you, extract, and then put onto a system. That's one way of doing things, top down. The other is bottom up, looking at the data itself, starting to understand the data, analyze the data, extract from the data using machine learning and other such tools, and you wind up with a mechanism to understand and, in fact, predict. Getting it done, an issue for me is the very high cost that we've had in the past of using system integrators. I don't know that everybody is with that, but there was a concern that city staff, government staff couldn't get this done because we're not motivated, we're not smart, we're not dedicated. Nonsense. We're smart, we're motivated, we're dedicated, and we're doing it. And we're doing it on our own, and we're doing it through consultants that we're managing directly. So we're able to bring in specific knowledge as we need it, and that gives us an ability to build institutional knowledge that, again, crosses boundaries, including administrations. A word on data governance. Again, Barbara Cohn is in the audience, and she can talk to this very specifically. But we have spent an inordinate amount of time to make sure that our governance of a project is correct, and also that the governance of our data is correct and appropriate. So each of our agencies demands and determines that their data belongs to them and is only used in a certain way appropriately, et cetera, for this particular purpose. Understanding that, being able to codify that into a machine is non-trivial, and finding a system that overrides the system of systems is just critically important. So there's the policy part of it that gets implemented into the machine part of it. And then I'll just buzz through a couple of slides on what are smart systems. So there are many different systems of systems, as my colleagues have described, as I've described as well, including the Easy Pass and all the rest. But in our domain, the direction that we are heading to is smart systems. So what is a smart system and why now? So basically, we're at a point where people are no longer mystified by this stuff. It used to be that, I would have these talks and people would look at me like I'm absolutely crazy. Well, you're going to have a system that actually predicts. Well, IBM showed us on Jeopardy that you can actually have a system which is pretty darn good, that it's not always accurate. I mean, it told us that Toronto is part of the United States, which is not, maybe, but not really. But so would I depend on Watson? If my life depended on it in the most critical circumstance? Probably not. But is it a good enough? My cardiologist thinks it's great. It's good enough to go ahead and remind him to tell his patients, take your enteric aspirin as a checklist. It also reminds him to go ahead and look through things that he may forget or may not see. There's a huge volume of health information that's out there. How do you keep up? How do you keep up with electronic medical records where there's a prediction, and maybe, let me take this a step, which we could either accept or not. One of my agencies is Department of Health and Mental Hygiene. So public health tells us that obesity is an issue. Now, Health and Hospitals sees a patient who's obese. What's the connection there? How do you predict? What can you possibly advise a patient who is pre-diabetic or is diabetic? What is that information which is available from a machine's point of view that is common and acceptable, that can be presented cost-effective, cheaply, consistently, objectively, et cetera? Those are some of the things I would hope that we would get to. And I'll simply say that these techniques, which were considered advanced techniques, I guess still considered advanced techniques, but are much more mainstream. And it's not golly gee whiz stuff. My second bullet here of power versus heuristics, a lot of these heuristics, a lot of these algorithms are tried and true. They were first developed in the 40s and 50s by folks like Norbert Wiener and Claude Shannon and others. They've been worked and reworked in so many different industries, and the good news is it's coming to our field as well. And if you look at skip technologies, you kind of go to certain countries who haven't had infrastructure with telephones, and now everybody's using a satellite phone. The fact that we haven't been the recipient of some advanced technology gives us an opportunity actually to kind of skip. And we can skip by system of systems. We still have things out there with green screens, and we can use those with the veneer of system, with the veneer of smart systems, and get a real leap forward. I think I've kind of covered this slide, but there really is an evolving capability. We've been always looking at things like reports, and now we're starting to understand information and knowledge, and from that knowledge we're able to start extracting wisdom, and we can do that both top-down by interviews and bottom-up through data. And the next slide actually I think is a better graphic of that. Oh, well, there's one slide ahead. Question of, let me do the next slide and come back to this one. So this slide, the intelligent system environment is where we're heading and how we're heading there. At Connect, we are past the data stage, we are well into the information stage, and we're starting to scratch the surface on knowledge, and hopefully within this administration we'll still get to the part of knowledge. Of wisdom, excuse me. So we're looking to have better outcomes while reducing bad things like system cost, or total cost of benefits. In other words, if I can get to a point where one of my clients is getting the best possible outcome while reducing the cost to the government, that's a great place to be. If I just reduce the cost, that's not so good. If I can just, we can always increase the outcome, maybe with unlimited time and unlimited money, but if you can do both, and you can do that mini-max kind of problem, that's a good place to be. Along the top, I talk about fraud. We could extract fraud from these systems as well, or start to look at fraud from these systems, but it's not just the I saved $1 type of fraud. Somebody is gaming the system, but it's other types of fraud, which is, am I really providing the best possible services to my client? Am I providing the best possible services to the individual at the right time? Or am I doing something like, we've had a situation where some of our workers were saying they're visiting our children and not visiting our children. That's a fraud which I'd like to know about, and we can detect that through pattern detection across systems, because money is money, but that if the kid isn't being helped and the kid is in fact being hurt because of a lie, that's a fraud that we really can't abide by. Let me go back to the previous slide. The question as we build this is, do we build this using open source, mostly Apache, and some of the technologies I've talked about, like Hadoop and Mahout and others, are available through open source. There's a high cost and a high complexity of doing it that way. Another way of doing it is working with the vendors, looking for engineered solutions, looking for commodity servers, looking for off-the-shelf type of stuff, and all the vendors, IBM, Oracle, EMC, et cetera, have these technologies and good glue to put together. But the last part is really important, which is the relationship with the vendors and actually getting the vendors to appreciate the guidance which is coming from our world, because we're not financial services, and a lot of these technologies are being used. I'm not opposed to free commerce. I'm not opposed to capitalism, quite the contrary. But most of these technologies are coming out of the world of, how can I sell somebody online something they don't need? So the technology is great, and we could use that technology for a very good purpose, which is, how do I, in fact, help my client who needs a service at that particular time? There's one last takeaway, which is keep your expectations real. This is the classic Gartner, optimism versus the trough of disappointment and all the rest. And I think if we're looking at some of the systems I'm talking about, these smart systems, we're still on the way up. There are all kinds of expectations, but don't you worry, after we implement it, people are going to go ahead and say, but it didn't do this, and they'll be disappointed. But that's okay, because it starts to settle out, and we're still on the upward climb of that pendulum, and I think that over time it'll start to level out. So that's what we're doing, and thank you.
Thank you, panel. That was great. I, for one, am convinced we really need a lot more systems engineering and system of systems engineering, so hopefully you feel that way. I have a couple questions. We have about a half hour for discussion now, and I've got a couple questions to get the discussion started, although with this crowd, that's probably not necessary, but we'll do it anyway. If I can find it here. And as I said, I'm convinced, but how about you? Do you see places where this approach, is this different? Maybe many of you I know are doing this, so maybe it seems very familiar to you. Did you see anything here that might apply? Do you see barriers to taking a system of systems approach? And the third question that we really didn't focus on directly, but there's obviously in the range of examples we had, even in the two examples here and the several that Charles talked about, you can see that there's very different categories of systems. They all share some characteristics that Charles walked through: the independence of management, independent operation, evolutionary behavior, emergent behavior. But on the one end, Wayne talked about what some would refer to as a natural system, where it's a small effort. There's no standards, no big program. It just kind of evolves. On the other end, a directed system, you could think of the air traffic control system or the national air system, where there's definitely standards and rules and regulations, and there's obvious reasons for that. And then there's everything in between, and most of the things fall someplace in between. I think the reason why that's relevant to us is depending on how we think the Health and Human Services systems should develop and how it's best governed, or it depends on where we think it falls in the spectrum. I think it's pretty clear that it's not something that's directed, that there's a top-level direction of this is the way it's going to be throughout the nation. I would say that right now it's more on the natural end of the spectrum, that each county, each state, more or less develops it in the way they see fit. And the question is there some, maybe a point where more collaboration would be helpful, more sharing, and as a minimum, just sharing ideas, sharing objectives, coming up with common solutions. So that's something else for us all to think about. With that, I'd like to turn it over to you, and you can comment on these questions or anything else that you might have in mind. Or you can, if you have specific questions, we had some very interesting topics here in the presentation. So if there's something specific you'd like to ask of any of the panelists, feel free. And with that.
Can you hear me? Is this working? Is this on? Okay, good. I mean, very interesting presentations. One of the questions I have, which I guess is at a kind of practical level, is understanding the system. I mean, first person started talking to Charles about, systems having boundaries. And I think one of the things that's complex from what we're doing is that in Health and Human Services, there's many different types of systems gathering data, different definitions. Some of them are legacy systems which, whether we want them to or not, are about to die. And some of them are systems that are going to continue in the future, whether we want them to continue with separate entities or not. And I think in order to use this approach, you need to have some kind of sense of where to understand there's a boundary that's fixed, when there's a boundary that's going to change, what are the strategies to deal with these boundaries? Because at least from my point of view, the boundaries define a lot of the complexity and the effort that it's going to take to integrate the data, which is what we're trying to do. And I think that's the one that's hardest for me to understand. How do we approach? Once I understand, kind of where the boundaries are going to be, I can start formulating approaches. But given all these things going on and across these disparate domains with different legislation, different agencies, that's where I think some of the complexity arises. And I just kind of would be interested in your views on that.
I think it's a great question. If you think back on both the processes that I talked about, what we're really talking in terms of focusing the effort is, and I dare say that my colleagues started off the same way, is some sort of an assessment. You need to get in and really understand, first of all, what the legacy systems can do, what they can't do. And then there's another piece that I didn't really emphasize that much, but it's a piece that I'll let Kim just mention it briefly, is there has to be, or there should be, some sort of an architecture. In other words, there's got to be a vision, there's got to be a big picture of what it is that we want. So to your point about defining those boundaries, the first question you want to ask, I think, is are those boundaries the correct ones? Do we need to revisit them because we've advanced, because things have changed? There's any number of reasons for that. Once you've done that, the term I'll use, and because this is kind of one of the things that I do, is it's a simple inventory of what it is that you have. And you'd be surprised that of the number of people that deal with these systems on a daily basis but never really take that inventory perspective. They know what it could do, they could recite that to you in their sleep, but when you start talking about what are they doing, what do they do, where's the overlaps, and so on and so forth, a lot of people don't really have that. So that assessment is absolutely the first piece. And in fact, I'll turn to my colleague from New York City and ask, I would assume you did some sort of an assessment.
Let's see if I can play this game too. We did, and we in fact have a reference architecture that we use, and that's that federated system in the beginning, and now we're looking at a different reference architecture for the big data and the BI as another architecture. There's another point to this, though, which is the crossing boundaries generally requires a standard. And we contribute heavily to one of the standards, which is NIEM, the National Information Exchange Model. We're developing internally another standard, which is HHS XML, or Extendable Markup Language, looking for our free-form text so we can extract meaning from our text. And I just want to say, alongside of that, so we're freely, on the engineering side, looking for boundaries and crossing boundaries, as well as the interchange of information, but alongside of that, also looking for policy and to ensure that policy is correct. And we're just about to introduce internally a new position, which is that of data steward. So not just understanding data and looking for encryption, not just understanding data and looking for policy appropriate use, but a data steward might look at something like this and say, if there's enough information out there, especially in a big data model, can I possibly reverse engineer and find out who is HIV positive? So even though this information is encrypted, and even though we have ability to use information correctly, as you cross boundaries, you also start to cross into new areas of concern, especially privacy and policy.
I thought Wayne might say something about the boundaries.
He's afraid of the microphone.
Even when you determine the boundaries when you start, as in Wayne's case, they change yearly, and in one case overnight.
Yeah, daily almost to a certain extent. From our perspective, as trying to build this system, and from that standpoint, we unfortunately didn't get to be the master architect or impose policy. We were more having to understand that from the bottom up, we had to be flexible enough to deal with it at any given moment. A hospital can decide to change their data inventory system and go from HL7 data transmission to free text, comma separated value. I mean, things change hourly. We've deployed hot fixes to systems, 10 minutes after they told us that the bug existed. The whole world of just being flexible was something we had to bake in as sort of our architectural decision from the very beginning, because we didn't have control of everything.
I have a bit of an administrative question. So as we're looking from the Health and Human Services perspective, one of the things we've been talking about is, as you look at a system of systems, there's more power and the potential that can be achieved when you bring these things together. But very often from an administrative funding perspective and outcome perspective, there's expected to be this very straight line between individual systems. So using your video, if I were the truck funding source, I wouldn't pay for the truck-to-canoe interface, even though truck-to-canoe interface would lead to the greater outcome of crossing the river. Are there any examples that you know of where entities are allowed to take the system-of-system approaches to achieve that bigger outcome with that administrative side of funding and outcomes?
The simple answer is yes, there are. But what you really question is who's paying for all this stuff. And quite honestly, that is totally, it depends. The sort of the typical stock answer when engineers don't know what else to say. No, but seriously, the challenge of what you describe really requires pretty much a group like this getting together and recognizing the power of what you can possibly do, listening to my colleagues describe what they've actually done, and then coming together and saying, okay, what's the best way to approach this? Now, my own personal experiences tends to be more towards the Department of Defense, and quite honestly, there is sort of a nice thing about the Department of Defense that happens in that they do have money. You all thought I was going to say they just tell you to do things, right? And that's not the case, by the way. I mean, Department of Defense is probably, and folks dealing with these things in the Department of Defense are probably worse than others in terms of protecting their own. One of the crusades that we're on, and I tried to touch on a little bit, but a real issue here is making people feel comfortable that the systems that they have right now, there's nothing going to happen to them. We're not making them obsolete. We're just going to make them better. And, you know, there used to be years ago an advertisement, I think it was for BASF, we don't make the this and we don't make the that, we just make it better. That's kind of how I see system of systems engineering. And so the answer to your question is that it really does depend. It depends on the systems, it depends on, literally in some cases, the personalities of the people involved, and of course it depends on funding availability. I'll pass that one off to somebody who's done it.
I'm just thinking that, you know, again, we benefit both top down and bottom up, because that's my thought for the day. We have a deputy mayor who is motivated and driven and in a position to go ahead and drive this, which is great. We have, for the most part, our Office of Management and Budget understands what we're doing. They get invited to our monthly sessions. There are independent meetings with them, so we educate them as well. And they appreciate the fact that by doing what we're doing, there's a savings to the city as well as better outcome. And then at the end of the day, this is not free, and it's not free to the agencies. We actually take their budget. We take a slice of the budget from the agencies, and we ask the agencies to help as well. So we will define an interface, but the agencies actually build that part of the interface. So even with legacy systems, or legacy systems that are going to be retired, we don't ask a lot, but we do ask from the agencies. And at the end of the day, when the agencies are actually contributing both effort as well as dollars, they are engaged and involved. And our OMB expects that the OMB might fund something for a certain part to get us, you know, to a build stage, but then OMB expects that the benefit is tangible and is subtracted from the agency's budget. So it's a good cycle.
Let me just add just one quick point. There is, I think, a significant aspect of something called cost avoidance that you need to be thinking about as well. We don't always use cost avoidance as a way to pay for things. You know, this is the wimpy cartoons. I'll gladly pay your Tuesday for a hamburger today. But cost avoidance is really something that you can pretty much quantify in many cases. And I'll just refer back to the first question on the boundaries and even more so the legacy systems that literally are 2 gasps away from dying. If you're starting to think now about those kinds of things, you can start making the decisions to not necessarily build your whole system of systems, but at least build your individual system in such a way that it would have the hooks and the things that a larger group would be able, make it easier for them in order to be able to tap into and get the benefit from a system of systems perspective.
I'll say, so we've lived through the fact that I think we've had somewhere around 15 different sponsors for Essence so far. One of the strategic decisions we've made was that we would use a single code base. So items and features and functionality developed by one sponsor get shared immediately when it's finished to all parties involved. We also play in a world where some of the users of the systems, individual states, may be getting that capability from a funding source at a federal level who isn't even allowed to see the system or the data. But it does pose challenges. Certain people will have from their funding source will have a requirement to build a feature, which is great, but no one's interested in funding documentation or funding that sort of lower level redesign after 10 years of use, because it doesn't meet their immediate need, or in order to really do it, you would have to pool money from 3 or 4, sort of funding sources together. So there are some things that slip through the cracks in that situation.
I've been thinking the last couple days about how public health might integrate with human services, and I keep thinking, well, we're doing a lot of system redesign because of meaningful use and other things, and how can we take advantage of that? And one of the themes I've heard a lot is that we need kind of a strong leadership decision that there will be integration. But as I listen to this discussion, I started thinking about the flexibility of Essence, because we use Essence, and we use it for some things at first, and then we figure out other things to use it for. And I hear you talk, Charles, about not necessarily affecting a lot of the component systems, but being able to link them together. And I wonder if there aren't some things that I can do, I'm not a director of a health department, but maybe there are things I can do having influence on the systems to make small connections and start to build this system of systems without it being a major initiative. Maybe I can start to lay the groundwork. But then I also wonder if that isn't too simple. And I look at New York City, and it sounds like what they're doing is not simple. It's not a small incremental thing. There is a lot of major planning behind it. And I guess I just like your reflections on that.
Well, I mean, I'll start. I guess it's like taking a shower and getting half wet. You know, I mean, if you're going to go down that path, you can't. I mean, it's like the potato chip bag, right? You can't stop at one. You got to keep on going. One of the things that if you want to do that, and I actually think that's a great idea, is the communication in forums like this to reach out and say, I'm going to do these kinds of things. Unfortunately, what we're finding, or what in my own personal experience is that he who has the money pays. So you mentioned leadership, and I mean, leadership's a really good thing, but if I were to stand up here and preach the gospel of systems, and you went away convinced, odds are that nothing had happened. But if I was preaching the gospel of systems and I handed each of you who were going to sign up a check for $1 million to go out and do it, I'll bet you things would happen. So I guess my point is that I absolutely applaud your inclinations to go down that path. I think it's the right thing. There are things that you can do to sort of get ready for it. But again, what they are is so contextually important to define that it's tough.
I was going to say, I really appreciate the concept of the agile development cycle. You know, the iterative design. There are times where knowing everything you want to do up front and having it all laid out on a platter and working towards it is great. But at least in our world, we started in a domain that hardly existed at the time. And, you know, it may seem small, but when you do enough of them and enough steps, it starts growing faster and faster, almost exponentially, to the point where you now have a large system of systems. And it's made up of a lot of small, successes. And by having those little small successes, it helps breed more interest to keep it going through.
Yeah, communication is really the key point.
And sometimes you don't do a good job of marketing what you do well. And I think that's something there are times where you have to step back and present at a conference or write the paper or something to that effect, where you get so down in the weeds of trying to get stuff accomplished every day. It does make a difference.
I want to key off on the Agile. So I completely agree with the Agile development, but also in the slide that I presented of open source. So I wouldn't necessarily advocate complete use of open source, but using open source foundations that are supported by the larger vendors is a way, I think, for us to reduce our costs. And again, I kind of use the term veneer technologies. If we look at the integration points among the existing systems, and we create this veneer using the appropriate standards on a reference architecture, using open source, and agile development, we've put enough of the buzzwords into the soup that the stew actually has some taste to it, and we can actually start to extract some things from that stew that are meaningful and not that costly. So Connect is not a small project. We've spent several years and tens of millions of dollars. However, if we look at it compared to the underlying systems from the underlying agencies, we are a fraction of the budget, yet the multiplier by putting this veneer, by using the system of system for all that it's capable of doing, by looking at the top of the pyramid, if we got this huge amount of data as a foundation, and that we're extracting from that data the information, the knowledge, and the wisdom, that wisdom that we've been kind of all after, the cost of that compared to building the rest of the pyramid is cheap.
It's 5 o'clock, so we got time for about one or two quick questions, and then we'll close. But you've been.
My question really is around the approach you take to systems design. So, in the examples in the slides, one of them was, you showed a complex system, the VR, right? And it was really, I think that would be complex.
Oh, sorry. That's much better. So let me start again. So my question is really around the sort of the approach you take to a systems of systems design. And in the slides, one of the examples was the prosthetic arm, right? And that's obviously very complex, but it'd be complex from a different reason than, let's say, a lot of social services systems where the complexity really isn't necessarily the technology, it's the people, and I mean that in quotes, right? It's it's relatively simple for conceptually and technically for a caseworker to be able to see, let's say, that the parent of one of the children under their care is receiving heroin treatment, but state statute says that the caseworker can't get that data about the parent, let's say. So as you see the complexity in some areas being just strictly technical in math and physiology, in other areas where it's really more a lot of times people, process, and other things, do you approach those type of problems fundamentally different from how you address them at the beginning of a project or an endeavor?
I can say, so I mentioned in one of my first slides that we embedded people from many different domains onto our project right off the bat. So public health, physician, a meteorologist, electrical engineer, systems engineer, computer science, math, stat, biomed. We put them all in a room, and I cannot tell you the number of fights we had in our hallways. It was mind-boggling because the different domains see problems from so many different angles, and it's so important to see that. What I thought might be a purely technical problem that I could solve in 10 minutes, the public health person would come in and say, no, you can't because of a people problem, and they could explain those things. And now I started becoming smarter from the technical side about those issues. And I mentioned the story of the math folks building, algorithms with pristine data and what happens when, they get into the real world. So I cannot tell you the value of having that team orientation that really does, isn't just the IT shop, with the requirements coming in one side and the product that actually doesn't work coming out the other side and starting again. But putting those teams together was hugely important for us.
Can I ask one quick question to that? And I don't mean to insult anybody here. Were the people in the domains that you mentioned, were they the supervisor or caseworker? In other words, were they people that manage people, or were they people that actually deliver the individual service you're talking about? Did you have both?
Well, the examples are a little bit different in our world. So, to our extent, as many different perspectives as you could get, the better. Even from our standpoint, we would have folks from individual states that would act one way, but yet when we went and dealt with another state, their policies were just different. One state wants to have 3 or 4 people kind of utilize Essence to monitor the entire world. Another state wants to distribute it out to 500 concurrent users. Those are totally different metrics. You start having to change those things. But by keeping everybody in a room, keeping everybody up to date in a loop, you quickly learn those things, that need to be done differently in those different realms. But if we, took the spec sheet and turned it around every 18 months, we'd be dead.
From an engineering perspective, when I talk system of systems, I personally include that human system in there. If you look at it from an engineering perspective, everything that we've been talking about from a hardware and software perspective has pretty well-defined metrics. We can look at it. We know what it can do. We know what it can't do. We know what it takes to break it. We know what it takes to fix it. But those systems can't do a couple things. Number one, they can't learn. We're going that direction. We're going that direction, but they really can't learn just yet. And they're not as adaptable as we like. That's where the human comes in. All this to say that anyone who is looking, especially in the field of health and human services, anyone who's looking at a system of systems without acknowledging the people side, without acknowledging the real challenge that you have, that first of all, you can't empirically measure what the person's going to do, nor can you predict what the person's going to do, really points to something that I've said and Wayne just said as well, which is the communication. And let's face it, we're never going to get everybody to agree to everything, but we'll settle for a simple majority in many cases just in order to advance the cause.
One more thing real quick. The other part of that is, we don't know what humans are going to do. So, plan for an iterative development that you're going to get it wrong once. Yeah. Instead of having the 18-month planning session with the 2-year development cycle, throw something on the wall in 3 months, see what happens, figure out why you were wrong, throw it away and start again. There's so many things you can learn by having a straw man in front of you that you're just not going to learn with whiteboards.
Just a quick little systems for dummies kind of answer these processes, they have inputs and they have outputs, and the inputs are always changing, maybe even growing, and then the consumers of your outputs are changing as well. So how do you design a system that's adaptable enough to address the needs of new consumers but still satisfy the needs of your legacy consumers?
So we tend to worry about the over-engineering a problem because we've sort of built it up to be so agile, and our turnaround time is mostly about 6 days, 5 days, something to that effect. So we feel like we're going to screw it up once, and that's okay. Then it takes 2 weeks to solve the problem instead of 1 week. But we sort of go with the strategy: don't generalize it till you've done it 3 times. Because if you over-engineer something and spent 3 weeks doing it, and it turns out you're wrong anyways, why did you do it that way? Agile would be the thing I would tell you the most to really hone in on.
Okay, with that, thank you again, panel, and thank you for your participation.